The first thing we're going to do is we're going to check this patient. Tamara noticed she's going to give me my mirror, my explorer. All the way down, all the way down. Okay, and we're just going to check the area real quick, and we'll use my halter. Pinkies out. Go ahead and put that back, and now we're going to numb our mannequin up. And remember, this is a mannequin, so don't try this at home on somebody. A little swab with some topical anesthetic. Goes back in the cap in case I would need to re-anesthetize. Okay, Tamara, let's show you the proper way to transfer a syringe. Okay? So we'll come all the way down, kind of hiding it from the patient. Into the muscle. Go ahead and get started. I'm going to get my high-speed handpiece out. Tamara is going to bring the water right on the tube to keep it cool. We don't want any kind of nerve involvement. What we're going to do, let's Okay, she's going to power wash that and go after the water. She's going to use her air water tip as another finger. Good job. She's going to dry that tooth off for me real good. We're going to use the closed tube now. Just air in there. She's going to retract, well, where her tongue would be. Keep it out of this closed tube. There we go. Every time I leave, she does a power wash on the tooth, getting it good and clean, dry, 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 and going after the water. I'm going to use this high speed again, Tamara, so you know I need water. Very good. The students know that more than likely when they go to externship in their place, water is going to come out of their high speed. But with this one, it doesn't, so that's why they have to spray it. Power wash that for me, dry, dry, dry. Go after the water, use it as your fingers. To retract it. Hey guys. Hey Jenna. Hey Jenna. I miss you. Not as this, it's this, okay? And this doesn't do anything, but when you dry the area and then you go back and forth, that's what gets you. Okay, come on. Yes. A little drop in that daffodil. That acrylic. What sets up the bond. Notice you do not stare at the light, although you want to. It's very pretty. We want to look through the orange shield to protect your eyes if you need to look. Okay, Tamara, you're going to put this stuff back over there. We're not going to do the global composite. Let's go straight to the packable. PFI ready, and Ashton, you put the lid back in the bond. You don't want it to set up. Very good. Notice that Tamara gave me the want to stick to the tube. Packing it. Put my instrument like that. Now she's going to go ahead and light her, and she'll have that composite gun ready for me one more time. If you're a nice finish, you'll help hold it for the student, the assistant. So, because as soon as your eyes leave the curing light, it starts to drip. So we try to guide it and hold it for you, if you're nice. Doing okay, Tamara? Good. Go ahead and have that composite back in your hand.
Michael says nice.
Nice. Thank you, Michael. We love our IT people. Always helping. Okay? We just keep adding layers and layers. Tamara knows to keep that curing light in her hand, CFI, and we're going to wipe the instrument. CFI, plug her in, please. All the way down. Very good. Been an assistant for 20 years, so when I play the doctor, I still want to be the assistant. So I'm wanting to do this for Tamara. Very good, Tamara. We'll put my wrist up. You're going to come in here and go ahead and do it one more time for me. And notice that the curing light is not touching the restorative filling material composite itself. You don't want to distort it. You kind of want to keep it the shape it is. We only have a few shades of our packable composite, so we kind of role play and Tamara would pick a shade, what shade composite, but like I said, we only have a few shades to deal with, so it will be a slightly different color than what it should be. Okay, very good. Take it light. There you go. All right, so we're going to do our trimming with our finishing burrs. Tamara knows that I don't really need any water, but I need suction and retraction. She will go ahead and have her air water syringe ready.
Micah says that's really interesting.
Thank you. Sometimes it's not a spectator sport. Sometimes. All right. So Tamara is retracting the tongue. I like to keep using her air water syringe to help with the lips so we don't pinch the lips. Because although a patient is numb, when they're not numb anymore, they feel the after effects of it. Just be as gentle as we can. Now, remember, people on Facebook, I am an assistant. I'm not a dentist, so this isn't going to be nearly as pretty, but it gives the students a good idea of what to expect.
Jessica Artrip watching.
Oh, I miss you, Jessica. I've heard nothing but good things about my students in externship right now. It's a good group of students. Okay, power wash that for me.
Yes, this is just practice. They're in the lab right now, just learning hands-on skills with their instructor, Miss Renee, right here. Miss Tamara over here is helping her out, and Ashton's behind. They're working. We've got a few other things set up we're going to move along to through the rest of this lab, so definitely stay tuned.
She'll power wash one more time. She'll check the mouth to make sure we haven't left anything. Again, this is a mannequin. He does not have a throat, so you just seen that cotton roll fall out. With this one, I counted him, okay? I'm going to give this back to Tamara. She's again going to check to make sure we got everything. Paper real fast. Just check this real super quick. We have them chomp, 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 chomp. I hand that back to her. And if there's no glue in the filling, which there's not, I don't have to adjust it. The patient be good to go. Tamara would set them up, make sure they're clear of anything on their face, they're nice and clean. You're going to hear me say, this is Kiki. She's going to take a fluoride treatment on Miss Martin. This is actually fluoride varnish. It's very, very easy. You can
Fluoride varnish.
After the procedure, there's nothing sticky. We do this on children, but we also do it on adults if they have an area that's sensitive. It acts as a covering, a little shield from cold. Sometimes even sweet, they are hypersensitive. She's going to put this on all areas of the teeth: mesial, distal, incisal, lingual, facial, occlusals. Once she does the anterior, you have to get back to the posterior, so she'll hold the lips and cheeks back. You can sit the little tray down, Kiki, if you need to, so you can have an extra set of hands. There you go. This flavor is great. I prefer it over
Great
the other
flavor.
caramels and pina coladas and banana. The nice thing about the varnish too is if they swallow a little bit of it, it does not make you sick to your stomach like the gel, maybe even the fungus. It's not that bad.
It does taste good.
Okay, very good. Okay. So now we're going to switch roles, and Miss Martin is going to take impressions on Kiki.
We'll move into impressions now.
Napkin on first. It does get kind of messy, which is okay. I tell the students don't worry about that as long as we clean everything up, including the patient when we're done. No. We do 2 to 2 with the alginate or 1 to 1 water powder ratio. She's going to do 2 to 2. It's just a little bit easier. I'd rather have a little bit more alginate than not enough. We're going to kind of mix it like this. Maybe come up here. Looks like I've been working with dog up and making pieces when I do this. So this is collared. Purple, we first start. Pink is setting, and white, we should have it straight into the mouth. She's going to come from the inside, like this. There you go. You can do a little trough if you want to. Alright, we're going to put that in her mouth. She's going to breathe through her nose. Bring your chin forward. Pull her lips out and her tongue comes up. And press all the way down both sides.